Whether you deliver vaginally or via cesarean section, you have several options for pain control during the labor and delivery process. Two common options that are provided by the anesthesia team include epidurals and spinals. These are both known as regional anesthesia. This presentation will review both options, including what to expect, risks, and benefits. Regional anesthesia can be used for labor pain and C-sections to provide pain relief to a specific part of the body. Epidurals and spinals can be used to safely give you medication. The medications used cause numbness and decreased pain sensation to your abdomen and legs. It begins working quickly and lasts several hours. An epidural is a catheter or small tube similar to an IV that is inserted into your back. It stays in place to continuously give you medication to keep you comfortable during labor and delivery. It is common for vaginal deliveries, but can also be used if you end up needing a C-section. A spinal is a one-time injection of medication. Spinals are used mostly during planned cesarean sections where more dense pain control and numbness is needed for surgery. Labor epidural involves using a needle to thread a very thin tube or epidural catheter into your lower back. As soon as the catheter is in, the needle comes back out and the medication is used to block the nerves that carry pain signals. This decreases the feeling from your belly button to the upper part of your legs. It can be given at just about any point during labor. The epidural is placed in a sterile manner. Your nurse and anesthesia provider will help you get into the best position to place the epidural. This usually involves you sitting upright at the edge of the bed. They may ask you to put your chin to your chest, curl over your belly, and push your lower back out. By getting into this position, the small spaces in your spine open up, and this can help the anesthesia provider to get the epidural into the correct spot quickly. Your anesthesia provider will feel your back and then clean the area. First, they numb the skin. This injection feels like a poke or a bee sting. This is to numb the skin and tissue to allow the epidural needle to be placed. After this, you will likely feel just pressure. Next, the epidural needle is used to reach the correct space. This is then used to thread the catheter into your back. Once in place, the catheter will be taped to your back. This keeps the catheter safe and sterile. Pain medication can then be given. It may take anywhere from 5 to 20 minutes to get good pain relief. The medication should help decrease your pain, but you may still feel some pressure. When the baby is closer to coming out, it is normal to start to feel more pressure and discomfort. When it comes time to push and deliver the baby, this helps you to be more effective in pushing. You usually have to stay in bed after an epidural, as you will experience loss of sensation and weakness in your legs. The time it takes to place the epidural varies, but usually around 10 to 20 minutes. The epidural stays in place until you deliver your baby. Once you deliver, the medication is stopped and the catheter is removed. Movement and sensation will come back within an hour or two. The patient-controlled epidural analgesia allows you to be in control of your pain management. You will be given a button that is attached to the epidural pain pump. The epidural will give you a continuous set infusion of medication. If you feel you are having more pain, you can push the button to receive extra medication. The pump can give you more medication every 15 minutes or up to 3 extra doses per hour. If you feel your pain is still not well controlled, let your nurse know so that they can have the anesthesia team come to evaluate the epidural. Only you can push the button for medication. This is the most important thing for your safety so that you do not get too much of the medication. A spinal anesthetic is a single-shot injection that delivers numbing and pain medication near the nerves in your spine to numb from your nipple line down to your toes. Spinals are usually given in the operating room immediately before C-sections. These medications usually last about 1.5 to 2 hours. As they wear off, you will slowly begin to get sensation and movement back. Spinals are placed similarly to epidurals. The nurse will help you sit at the edge of the bed and get into correct position. Again, position is very important for quick placement. Your back will be cleaned and numbing medication will be injected into the skin and tissue. A small needle is used to give the medication and then immediately removed. Nothing remains in your back. You will quickly feel the effects of the spinal. Your bottom or legs may start to feel heavy, numb, tingly, or just different within seconds. You will be assisted to lay on your back right away, and the OR team will begin preparing you for the C-section. It is not uncommon to feel nauseous after the spinal is placed. If you do, let your anesthesia provider know right away. This can be a sign that your blood pressure has dropped, and you will be given a medication in the IV to treat it. This is expected. The OB doctor will test your spinal to make sure that you do not feel any pain before they start the surgery. While you should not feel any pain, it is normal to feel pressure, pulling, or tugging, especially close to the delivery of the baby. Benefits of regional anesthesia include good pain relief. In fact, epidurals are the most effective pain relief during labor. Over 60% of women in the U.S. use them during childbirth. Spinals and epidurals both begin to work quickly and are considered safe for both mother and baby. Weak concentration of numbing and pain medications are used. Only a tiny amount gets into the mother's bloodstream. Unlike IV medication, it does not cause drowsiness, and it is also safe to breastfeed your baby right after delivery. Medication doses for epidurals can be adjusted as needed. Epidurals can lower stress hormone levels from labor pain. Many women are much more comfortable after an epidural is placed and can even rest or sleep before delivery. Both epidurals and spinals allow you to be fully awake and aware during the birthing experience. Some possible or common side effects include a drop in your blood pressure, nausea, itching, fever, shivering, heaviness in the legs, and soreness in the back for a few days. With any procedure, there are risks involved. The most common and fortunately least serious risk is that the epidural does not work or that it's only one-sided. If this does happen, there are a few options. Your nurse may have you lay on your side. The catheter can also be adjusted by an anesthesia provider, or it may even need to be replaced. In very rare or emergent cases that your spinal or epidural is not providing adequate relief, you may need to go all the way under general anesthesia for a C-section, in which case you would be sleeping during delivery. You could develop a bad headache or what is called a post-dural puncture headache, for which there are several treatments available. It is very rare that the epidural catheter is in the wrong place, causing medication to enter the spinal fluid or the bloodstream. More serious but rare risks involve bleeding or infection. The anesthesia provider will assess your blood work and medical history before doing the procedure to decrease the risk of bleeding and ensure you're an appropriate candidate. The procedures are performed in a sterile manner to decrease the risk of infection. It is extremely rare that severe nerve damage is caused by the epidural or spinal. This is approximately 1 in 250,000 cases. Every pregnant woman should have the tools to make informed decisions. The decision is your choice, and you are free to change your mind at any point. If you have any questions or need more information, please don't hesitate to continue the discussion of pain management options with your OB or anesthesia provider. We're here to ensure that you feel fully informed and comfortable with your pain management options for labor.